everyone is there that should be observed that most of the old old persons are there that are to be suffer by uh, pain in the joints are there, somewhere difficulties are there that are to be observed while walking, sitting. They are having much more pain in that particular position, and the bones are there or the joints are there, the shows the pains or the difficulty in case of the performing the normal functions also. This is because of the rheumatoid arthritis. In a word, near about 0.5 to 1% people are there that are to be suffer by this one rheumatoid arthritis. How much? 0.5 to 1% of the people are there that are to be suffer by this one particular rheumatoid arthritis. This disease is there that is we occur mostly more above the age of 45. In some case, that is we appears below the age of the 45, but most commonly this is to be appear in the age of 45 to 60 or 70. In that case, the rheumatoid arthritis is there that she occurs. In this rheumatoid arthritis, there is a inflammation is there that is we observe, and the pains are there, swellings are there that is we observe in the joints is there, and what is the bones are there that shows the movement beyond the musculoskeletal system is there. Our bones are there or the joints are there that should totally uh, present in a system of the musculoskeletal. But if the person is suffered by the rheumatoid arthritis, the bone or the joint shows the movement beyond the musculoskeletal system, so that there is a difficulty in case of the balancing. In case of the old persons are there, such type of the problems are there that is will appear in case of this one particular rheumatoid arthritis. In this case, what we observe this one, the swelling is there that we found in case of this one particular fingers are there or the joints are there, and this one particular region also there is inflammation is there that you observe. You have to observe see that when it is a rheumatoid arthritis condition is there is much more severe. The bending is there that we observe. This is one of the sign and symptoms of the rheumatoid arthritis is there. That is a bending of the bones are there, and now we see that this definition, about 0.5 to 1% of the people are suffer by this one particular disease, that is a rheumatoid arthritis, that is a pain in the joints. Then inflammation is there that involves many joints, not a single joint, but many joints are there that should be involved in case of the rheumatoid arthritis. And the moose joint shows the movement beyond the musculoskeletal system, means the movement is there is not in the control of the musculoskeletal system, because the bones are joined to the skeletal system and the muscles, and depends on that the movement is there that should be found, and the functions are there that should be done. But in case of the rheumatoid arthritis, the bones are there or the joints are there that are to be moved, that are not in the control of that one particular musculoskeletal system, and because of that imbalancing is there that should be observed. Now, why this occur? Rheumatoid arthritis is nothing but our immune system is there, that is we can say that autoimmune system, but this is a disorder where in case of the joint that the synovial fluid is there is present, and the membrane which is present in this one particular which known as a synovial membrane. Whereas in case of the rheumatoid arthritis, our autoimmune disorder is there, means autoimmune system is there, that is we think that this one particular synovial membrane is there, that is a foreign particle. What is the particle which is to enter in our body? Our body or immune system tries to remove that one particular particle throughout your body, or try to destroy that one particular body, so that in this case what is the synovial membrane is there, that is we get destroyed by our autoimmune system, and because of this the rheumatoid arthritis condition is there that actually appears. This is the synovial membrane is there which is we observe, and our immune system is there that shows attack on this one particular synovial membrane, and there is a destruction of this one particular membrane is occurs. Rheumatoid arthritis is a chronic, means long-term disease, inflammatory disorder is there that may affect many tissue organs, but mainly the attack is there that is found in the joints, and that causes the inflammation, After inflammation, there is a reddening, swelling, pain. Likewise, the series of the pains are there that we observe. That is the inflammatory synovitis is there, means the inflammatory membrane is there that she found in that one particular location. That is the inflammatory synovitis. Here you have to be observe this one. This is a normal bones are there. Then these are the cartilages are there. We have to be observed in that on the upper bone and to this one lower bone there is a cartilages are there that is we observe, and in between these two cartilages this is your synovial membrane is there, and this one synovial fluid is there is to be present at that one particular location, or we can say that this is a complete body is there which is to be filled with synovial fluid. There is a capsule ligaments are there. In this one particular capsule ligaments, a particular box is there that is filled with the synovial fluid, and that is to be acting as a lubricating fluid, whereas these cartilages are there that is to be acting as a protective covering to the bones are there, so that when the bones are there that are to be joined to each other, when the movement is there that is to be occur, there is a no friction is there that is to be occur because of the rubber like cushion. The cartilages are there that are to place a work just like a rubber like pushing are there, and to this one rubber like pushing there is a synovial fluid there that should be working, which is we acts as a lubricating also. In this way the joints is there. This is the normal um, joint is there. Now in the next slide we are going to see that when is a rheumatoid arthritis is there, that is we occur, just you have to be observed clearly at this one particular locations. Okay, now in case of the next one slide we see that yes, this is the rheumatoid arthritis bone and the joints is there. In the last slide we have to be observe this one, the bones are there that are to be sharp one, the cartilages are there that are somewhat thick one, whereas in case of the rheumatoid arthritis the cartilages become thin one. What is the synovial fluid which is to be acts as a lubricating fluid, that is we become somewhat rancid, or we can say that that is the not having the normal components, and which is not to be useful as a lubricating fluid also, and because of that the somewhat pains are there that is to observe in the bones initially. Sometimes you have to be observed that there is a water is there that is to be observed in case of the joint. Sometimes the physician may remove that one particular water through this one particular knee joints. This is because of the there is a destruction in there that she found in case of this one joints, so that synovial fluid is not having showing its proper function, and because of that the thickness of the cartilages is there ratio of so that wearing as well as tearing is there ratio of erosion is there should be found in case of the bone corner, so that they are to be fractionated with each other, and so that there is a tearing, and because of the some of the particles are there that is will release from this one particular bone, and that is will remain or comes in case of this one particular cartilages, and you that when there is a smooth surface there that is will move with each other, if there is a stone is there that is you observe, that creates a much more difficulty in that one particular, and because of that the problems are there that is we appears, and the more pains are there that you observe in that one particular patients. What is the capsule or the ligaments are there that are not having a proper strength to withstand this one particular bones cartilages at that one particular locations. What are the risk factors are there? First one is there that is a idiopathic condition is there, means initially the why this rheumatoid arthritis condition is occur that is not known. um, as it is a chronic one, means since long time the condition is there which will appear, but most of the patients are there that are not going to take care, not going to give attention to that one particular area, or the we can say that knee joints are there is a pains are there, they are going to take somewhat painkiller and they get relief, and they have to continue the series of this one particular painkiller consumptions, and after that they found that their knees are there that are not working properly, the cartilages are there that are wear, and the fluid if there is not somewhat having that one particular lubricating power, is there somewhat granular structure is there that should be observed, and that causes the rheumatoid arthritis. In positive family history means if the parents are there that are having this one rheumatoid arthritis disease, definitely that is to be transferred to their children also. Then inherited tissue type major histocompatibility complex. That is, in short, it is known as MHC antigen. Is one type of the antigen is there. Then smoking habit. Initially, in young age, most of the people are there that are having this one particular habit, but in the old age, that smoking habit create the much more amount of the components are there, or that chemicals are there that are to be deposited, and that is one of the cause is responsible to have the rheumatoid arthritis. Then bacterial as well as the fungal infections are there in child age or in adult age. If there is a bacterial or the fungal infections are there, that fungus may enter into the your joints. If the severity is there is more, that because of somewhat antibiotic treatment we have to get covered, but that go invade into the joints, and here there shows their growth, and because of that one growth, the cartilages, synovial fluids get disturbed, or the component get disturbed, and they get contaminated, and because of which the rheumatoid arthritis is there, that issue appears, which is one of the important factors is there that is responsible to cause rheumatoid arthritis. Then herpes simplex virus infection, that virus is there is also responsible to cause this one particular rheumatoid arthritis. Then Epstein-Barr virus. This is one of the viruses there among the 9 virus which is responsible to cause rheumatoid arthritis condition. That is a human gamma herpes virus 4 is there. That's the EBV. That is human gamma herpes virus is there. The next one factor is there, that is a vitamin D deficiency. If there is a bones are there that are become soft, so in that case physician is prescribing the calcium therapy. So if you are going to consume this calcium in a huge quantity, there is no absorption. The calcium is there is not to be appears in your body or the blood circulation in active form, because for the absorption of the calcium there is a need of vitamin D. So vitamin, if the concentration of the vitamin D is more in your body, then if you're going to consume the calcium in your body, then in that case the absorption of the calcium is appear in presence of the vitamin D, and it shows its beneficial effect in your body. The incidence is there, that is a rheumatoid arthritis is occur mostly near about 0.5 to 1% population in the USA, not in the USA but all over the world. That one particular population is there that should suffer by rheumatoid arthritis. The appearance of the rheumatoid arthritis is more in case of the female as compared to male. If you have to see the percentage behind the 3 females, if they are to be suffer by rheumatoid arthritis, only one male is suffered by rheumatoid arthritis. But the peoples of any age can affect by rheumatoid arthritis. The peak age, or we can say that average age is there 45 to 65, but onset is there, it should be started. It means occurrence of this one rheumatoid arthritis is there, it should be started from age of 20 to 45 years. Near about 75% of these are women. Means 75 percentage rheumatoid arthritis appears in women, and 25% rheumatoid arthritis appear in men. This disease strikes the woman 3 times more often than men. Now we are going to see the pathophysiology, the presentation of the antigen of the T cell. T cell is a key component which is mostly observed in case of the rheumatoid arthritis immune system in that one particular patient. If the patient is suffered by the rheumatoid arthritis, and if you are going to check the components of the immune system in that case, T cell is the one of the important component in there which is responsible to have this one particular as a component of the immune system. Now the next one is there T and the B cell proliferation angiogenesis in synovial. Angiogenesis is nothing but increase in the inflamed human synovium. Means what is the surface is there, that is the inflamed surface is there, that should be increased. Possibly the endothelial cells proliferation is there, then migrations is there. Migration means transfer from one location to the another location, and the increase in the rheumatoid arthritis condition is there, that should occur. Means initially that should appear at one particular location, and then because of that one, the presence of this one particular proliferation, that should be spread throughout that one particular area, and that should be appears. Now, what is the correlation of the T and the B cell? The rheumatoid arthritis condition is mostly occur because of the B cell. B cell can synthesize the cytokinins and the membrane that associated with the rheumatoid arthritis. Means in case of the rheumatoid arthritis, what is the synthesis of the cytokinin is there that is occur. This is because of the B cell, and T cell is mostly responsible to activate this B cell. Means T cell is a stimulator to the B cell. B cell causes release or synthesis of the cytokinin and the membrane where the rheumatoid arthritis is there that is found. Then neutrophil accumulation in the synovial fluid. As you know that the body's defense mechanism is there where there is any type of the inflammation is there, the neutrophils are there that should appear in that particular area is there. Then synovitis is nothing but inflammation of the synovial membrane. If the synovial membrane in the previous that first figures, you have to be observed that the synovial membrane is there that is be present. There is inflammation is there that is found. That inflammation or that particular inflamed membrane is nothing but your synovitis is there. Then early pannus formation is there. The pannus is a sheet of the inflammatory granular tissue that spread on the synovial membrane. Means when the cartilages are there that are to be smooth one, they show a continuous movement is there that should be observed just like this one. But if there is a somewhat granular structure here that should be observed, then that creates a problem. And because of that, when it is a frictions are there that are to be occur, just like that one, the frictions are there that are should be appears. I mean, there is no smooth, just like the lubricating ball and socket type of the joints are there. In that case, easy friction is there that should occur. But if the somewhat stones, smaller fine stones are there that are to be get entrapped, then it creates a difficulty while walking. When the stones are there that will get inserted into your shoes, then you feel a difficulty while walking. The same one is there that you appear in case of this one, but that is somewhat more in case of this one. That is the early pannus formation is there. Then subchondral bone erosion is there because of that one particular granular fraction. The bone erosion of the bones means bones become soft and agings are there that are to be removed from this one particular bone, and the smoothness of the bone is converted into the roughness, and because of that tearing is occur in the bones. The Pannis invasion of the cartilage, that is a chondrotype proliferation, is there, is to be occurs. Now the next one is there, that is a laxity of the ligaments are there. You see that the laxity of the ligaments means what are the ligaments are there which are to be utilized to hold the bones in a proper position and to have a proper movement. But if the laxity means ligaments are there that are somewhat smooth as well as the loose one, so that the movement of the bone is not proper one. It shows somewhat more movement beyond that one particular musculoskeletal system, and because of which the problems are there that show appears in the old persons, whereas the movement of the bones is there is not occur properly, and sometimes that balance may get disturbed in the old patients also. This is the joint instability is there that were to be observed. The joints are there that are not stable one because of the rheumatoid arthritis. There is a that's the bones are there that are to be moved just like that one, just like that slight one. If the movement is there, it's just like this one position only, forward and backward position only. But if the ligaments are there that are somewhat loose one, that shows somewhat just like motions are there that should be appear in along with this one forward as well as backward, means left right motion along with the forward and the backward motion, so that the individual can get difficulty in balancing his weight while standing position. Then contractures are there, decreased intimate complications are there, that conditions are there that issue appears. Then sign and symptoms are there in case of this one rheumatoid arthritis. How can we say that the person is suffered by the rheumatoid arthritis? These are the common one that you have to be observed while walking. There's a difficulty, pains, swellings are there while early in the morning when the patients are there that is we try to walk. It shows somewhat difficulty. stiffness is there that should be observed in that one particular patient. He always feel difficulty. He is somewhere he is shows somewhat more seriousness regarding that one particular moment is there. The symptoms and the sign are there. Rheumatoid arthritis is there. The joints of the hands are often very first. Means initial attack of the rheumatoid arthritis is there. That is on the joints of the finger in the hands are there. Rheumatoid arthritis. These joints are swollen, red, and tender when the squeeze one. This swelling is there. That is due to be synovitis. Here you have to be observed that there is a swelling is there. That is to be observed in the both the hands are there, where the fingers are there, that is be started, or at the base of the finger, the swelling as well as the inflammation is found. The second one is there, that is a rheumatoid arthritis hands are there. Here the bending of the fingers are there, that is to be appear. There is a swelling is there, that should be occurs. Why this is to be occur? Because what is the synovial fluid which is to be present, that is to be converted into the granular form. So or we can say that precipitation of the synovial fluid is there, should occur, because of which the cartilages are there that are degrade, or somewhat deformation or degeneration of the cartilage is there, issue occur. Then thickened synovial membrane is there, means what the liquidity of the synovial fluid is there, it goes on decreasing, and it shows somewhat thickness is there. I mean, because of which the proper lubrication is there is not occur, and it shows difficulty in case of the movement is there. This is your rheumatoid arthritis hands. Here is also when this severity is more, and the treatments are there that is not to be done in case of this one. In a village area, you have to be observed, most of the peoples or old peoples are there that is we suffer by this type of the symptoms are there. That is nothing but is your rheumatoid arthritis conditions are there. Then swan neck deformity is there. You have to be observed this one, that is nothing but your swan neck condition is there. Here you have to be observed when you're going to stretch your finger, but our normal fingers are there that are stretched one. But in this one rheumatoid arthritis, the fingers are there that should be shown just like this one. Fingers are there that should be appears. Just like this one, bendings are there that should be appears in case of this one fingers. That is nothing but your rheumatoid arthritis conditions are there, that is the interpharyngeal joints, while the distal interpharyngeal joints are is a flex one. Okay, and this is the condition is there. Here we see that this is the swan neck finger is there, the bending of the finger is there. Now mallet fingers are there. The mallet finger is a simple flexion deformity of the distal interpharyngeal joint, preventing the extension. When we are going to extend the finger, that is not show a proper straight position. They are always bent at that particular metapharyngeal or interpharyngeal joints are there. Then deformity of the thumbs are there. If the severity of the rheumatoid arthritis is there, the thumbs are there that are shows in the opposite direction bending. Normally our fingers are there that are to be bent in this one particular direction, but in this one rheumatoid arthritis that are to be bent in this one opposite direction. That is a hyperextension of the interpharyngeal joint of the thumb is there. Here we can see that this is the condition is there, that you show that the hyperextension of the interpharyngeal joint of the thumb. What is the joint in the thumb is there, that is we shows hyperextension. Now some of the conditions are there which usually appear in case of the rheumatoid arthritis is nothing but is your fatigue condition. Fatigue means the patient is there is not going to respond to the particular, if there is a continuous movement, regular movement is there, for this one particular regular movement patient shows difficulty. That is a fatigue condition is there. Joint pains are there in this one particular whenever what are the total number of the joints are there, there is a always pain is there, that is you observe in that one particular condition. Joint tenderness is there, means muscles are there that are not performing their function, because of the bones are there that are somewhat rigid one. because of the synovial fluid precipitation. Joint, there is a swelling in the joints are there because of the swelling. There is a pain, is there redness, is there that is be appear. These are the series of the um, symptoms are there which is be appear in case of this one rheumatoid arthritis. Joint worms are there. Now, somewhat warmness is there because of the inflammation. That particular temperature in that particular joints is somewhat more as compared to your normal body temperature. Then joint stiffness is there, loss of the joint range of motions are there, means normal for normal walking conditions or normal sitting conditions are there, that is not to be done by that one particular patient. You always require help. Some of the sticks are there or some of the appliances are there which should be available to perform, such as the walkers are there. Then this one particular sticks are there which is be useful for this one particular patients. Then many joints affected, that is a polyarthritis, mean much more number of the, not the single joint but more number of the joints are affected by this one particular rheumatoid arthritis. Limping, the action of walking with the difficulty is there. You have to be also this one particular person when at the age of 45 or more than 45, if he suffer by this rheumatoid arthritis, he require support of the stick because he is not able to walk properly. Is there giant deformity, what are the joints are there that are to be deformed. The legs are there that is not to be having a straight condition because the ligaments which are to be present here in this one particular region, that are somewhat loose ones, so that the bones, what are the straight legs are there, that is not to be found. There is a bending of the legs in a somewhat degree is there should be appear. In this one particular case, we have to observe that the rheumatoid arthritis is there that's found in both the legs because both the legs shows the bendings are there. Here only a single leg shows the bending, where in this case the both legs shows bending. Both sides of the body are affected, that is the symmetric conditions are there. Diagnosis, how can we diagnose the disease condition, such as the x-ray, which is the most important thing there. By taking the x-ray you can see that patient bones are there or the deformities in the bones, cartilages, all these things are there that should be tested of this particular rheumatoid arthritis patient. Then magnetic MRI, and this is nowadays it's also common whenever the proper diagnosis or the conclusion is very difficult by the X-ray technique. Then in that case the MRI is there is to be carried out, where the ultrasounds are there that are to be utilized, or the magnetic field is utilized in case of this one particular uh, scanning. Then blood tests is there that should be carried out. Rheumatoid factor is a specific antibody which is to be present in the blood. A negative rheumatoid factor does not rule out rheumatoid arthritis. The arthritis is then called the seronegative. Means in some case that RF factor is there is not to be present. If it is not to be present, then we can say that seronegative. The most common during the first year means that particular factor is not appear in that one particular patient in the initial condition when there is somewhat pains are there that you observe, and at the age of 20 to 25 where there is occurrence of that one particular disease is there, but actual the rheumatoid factor is there is not to be present, and converting to the seropositive status over time. As the time is goes on increase, means the patient comes to the age of 40 to 45, at that one particular age this one particular RF factor, that is the rheumatoid factor, is to be appears. Then anti-cetylated protein antibodies. Like rheumatoid factor, this testing is only positive in a proportion of all rheumatoid arthritis cases. Unlike rheumatoid factor, this test is rarely found positive if rheumatoid arthritis is not present, giving it specificity about 95% chances are there which are to be present. Then other blood tests which are to be present or available for this rheumatoid arthritis are there. That is a erythrocyte sedimentation rate. Erythrocyte sedimentation rate is nothing but the precipitation of the RBC. precipitation rate of the RBC in hour, how much quantity of the RBCs get precipitated in 1 hour. Then reactive protein, a protein is to be found in the blood in the response to the inflammation. Some of the proteins are also responsible to have inflammation, and then so that proteins, if it is present, the inflammation is there should be occur. Then which type of the proteins are there that are responsible, that it should be tested in full blood count. It gives inflammation about all blood cells. Then renal function, the kidney functions are there that should be tested, because sometimes the inflammation on the feet is there that should be observed because the failure of the kidney. In that case, the swelling is there, it should be observed in the legs also, or the pains are there that should appear, so that the renal test, or we can see that kidney test is also carried out. Then liver enzyme, it gives information to the state of the patient's liver, whether the patient's liver is working properly or not, so that which type of the treatment is there should be given, or some of the drug therapy there should be continue, what are the drawbacks of that one particular therapy there should be offered or not, that is should be done by this one particular liver enzymes. Now the medical management, which type of the treatment they are that should be suitable for this one. Salicylate or acetylated, or we can say that aspirin is there should be given. Non-acylated, that is a choline, magnesium trisilicate are there, that is also given. Then choline salicylates are there that are to be checked for this one particular patients. Then non-steroidal anti-inflammatory drugs are there, such as the diclofenac sodium. Overon is the best common drugs is there, which should be which containing the diclofenac sodium. Then etodolac is there, that is a lodin. Then fluorobiprofen is there, that is NSAID. Then ibuprofen is there. Then meclofenem is there. Then Meclozicam is there. Likewise, the various drugs are there that comes under this one non-steroidal anti-inflammatory drugs. Means they are not steroidal therapy is there. Then corticosteroid, whenever the non-steroidal anti-inflammatory drugs are there that are not working or giving the relief to the patient, in that case, corticosteroids are there that are to be given, such as the anti-inflammatory analgesic used for a short duration and at a low dose. Means non-steroidal drugs are there which to be given to that one particular patient. It has certain limit, but in that one particular dose, if the patient is there is not getting the relief, in that case the corticosteroids are there that is given, such as the prednisone is there, then prednisolone is there, then hydrocortisone is there, then intra-articular injections are there. Sometimes nowadays this is the best practice is there that should be done everywhere. We have to be found that somewhat the smaller injections are there that are to be given by a physician at the joints where there is a pains are there that should observe, but this is not a proper treatment is there. These are the only the painkiller agents are there that are to be released slowly so that patient get relief, but there is no healing process if there is to occur. Only the patient feel that there is a no pain, but what is the destruction of the bone or deformation of the bone or the cartilages are there that are goes on, and sometimes the case may worsen because patient because of this one particular drug therapy, patient is not getting aware regarding the pains which are to occur in the legs or the joints, but the deformation is to be continued, so that these treatments are there that is not a proper one. If the patient is there that is too much older and he is unable to walk, and in that case if there is a pain in the joints are there, then you in that case you can give this type of the treatment. But if the patient is walking, he is performing his functions normally, and he should have some rheumatoid arthritis, and because of that you if you have to use such treatment, it may create a problem also. Then topical analgesics are there. This capsaicin, which is obtained from the capsicum extract, is there that is used as a counter irritant, or we can say that topical analgesic is there. Means this misguides your mind concentration from that one particular affected or painful area towards where you have to be applied. It's from the internal pain that you have to be comes to the external in where you have to be apply this one particular topical analgesic. And it also shows the what is the blood flow to that one particular area is goes on increasing, and because of that the somewhere the pain relief conditions are there that should occur. If all no single medicines are there that should work, no corticosteroid therapy is there should work, in that case surgical treatments are there, that is one of the choices there in that one particular. What are the cartilages are there that are to be totally replaced by the artificial cartilages, or somewhere the if your bones are there that are to be deformed, then in that case the two bones or the two joints are there that is be um, supported by a steel plate, so that there is no deformity or there is no joining if there is to be present, because they are having a side support, just like this one side support is there is to be found in that case. And likewise, so that these are the supporters are there, and here the joints are there or the bones are there that are to be moved properly, just like the conditions are there that is we appear, just like this one. These two are the joints. Suppose these are the two bones are there, if there is a deformation if there should appears, then by using the surgical treatment these two bones are there that are to be goes away from each other, and that these are the two supportive plates are there that should be attached to this there, so that there is no joints are there that should be found, just like the condition is there that it should be appear in case of this one, that is a surgical consider for the people who have the severe rheumatoid arthritis problem. Then cervical spinal fusion to treat the severe neck pain. Then nerve problems are there, finger and hand surgeries to correct the joint. Somewhere if there is a bending of the thumbs are there or the fingers are there, in that case the surgical treatments if they are actually given, because of which there is a corrective action and the correction in the structure of the hand or the finger if there should be carried out. Foot surgery such as the phalange head retain, resection is there issue carried out. Uh, then synovectomy to remove the inflamed joint tissue. Somewhere the surgery there should be carried out, and where the inflamed surface is there that should be removed from that one particular area is there is to be carried out. In this way, the rheumatoid arthritis chapter is there that is continued. Thank you.